Good morning.
Morning, Dad.
I didn't mean to put you on the spot there. So I am Matthew Smith, and I am the Prevention Programs Manager for AIDS New Brunswick. I'll start out with that I get a little nervous doing these, so if I speak really fast or need to slow down, my colleague Delta is going to tell me to do that, so in case I'm looking over there. I also like to start all of my presentations with something one of my professors used to start a new class with every year, and that was that I do not hold a monopoly on the truth. I try really, really hard to make sure that I'm well informed about my position, about what's going on in the community, but it is entirely possible that I will misspeak or mix my words up or have something completely wrong. So in the event that that happens, please come and tell me, let me know. I don't mind being corrected. I try really hard not to be wrong though. So AIDS New Brunswick is only one of 4 ASOs operating in New Brunswick, and so we work very collaboratively with, of course, Healing Our Nations, AIDS St. John, and AIDS Moncton, and of course ourselves to tackle the giant task of reducing the spread of HIV and helping those who are affected and infected by it. We at AIDS New Brunswick have a 3-pronged approach to addressing these issues, and we do them through prevention initiatives, education initiatives, and support initiatives. And so today I'm going to talk to you about my prevention initiatives that I have going on in the province. Certainly one of the biggest challenges that we face, and this is not going to come to a shock to everyone, is of course stigma and stereotyping and these barriers that we're all so well acquainted with. But actually one of the biggest barriers that we as an organization face is actually staff turnover. And so in the position that I run, where I'm responsible for 2 of the needle exchanges that are in the province, I've been with AIDS New Brunswick for 2 years this Thursday, and I'm the staff person that's been in that position the longest. And so when we look at our numbers, you can actually see statistically where we have a new staff turnover, because our numbers drop right through the floor as soon as that trust is gone, as soon as that relationship is gone. And so I'm very happy to report that when I was pulling numbers for this conference, we have reached an all-time high for needle distribution in Fredericton, where we are on tap to distribute 90,000 needles this year, which is the highest we've ever experienced. Now, Julie's going to come up here in a few minutes and talk about AIDS St. John, so I'll let her talk about her numbers, but we're nowhere near St. John's numbers. In Miramichi, our needle exchange in Miramichi is a new project that we just started last year on April 13th, and Delta, my colleague, is the person responsible for running that for me. Right now, within the first year in Miramichi, we have just under 100 clients accessing the service. We're on tap to distribute 8,000 needles, which is 4 times higher what we distributed in our first year in Fredericton. And I really like to put this out there. We're so happy to be in Miramichi, and I have actually never been to a community that was so welcoming for a needle exchange. I haven't heard a single negative thing from the community. We've heard from clergy, we've heard from doctors, we've heard from everyone. They're so happy that we're there. They're so happy that we're putting sterile needles into their community and taking the used ones back out and helping people. It's absolutely phenomenal. So statistically, I'm a big stats guy. And because there's a big youth focus to this, I want to talk a little bit about our numbers. So in Fredericton right now, we are sitting at around 300 clients, which is give or take every year, depending on a lot of things, methadone wait list and what have you. So, but currently, 34% of all of our clients are female, and 48% of them fall into the youth category. 66% of all of our clients obviously are male, and 35% of them fall into the youth category. And in Miramichi, 44% of all of our clients are youth, which means that in addition to that, 36 are female, half of which are youth, 59% male, with nearly again half that are youth.
Matt, what age range are you using for your youth?
I'm doing under 30, so up to 29. And so I know that Lois is here, and she's going to talk about the harms research, but we do work collaboratively, with a lot of different groups that are happening. And obviously in my position, we deal primarily with primary prevention. It's a needle exchange program. We're really trying to reduce the spread, keep people from becoming infected or sharing needles and infecting other people. But as some of you may know, my new executive director is Stephen Alexander, who was recently with the Canadian AIDS Society and is one of the people responsible for GIPA, the Greater Involvement of People Living with AIDS. And so one of the tasks that he has saddled me with, and one of the upcoming projects that we're really, really excited about, is that we're developing a greater involvement of people who use drugs. And the way that I'm doing this is we are going to quite literally invite in our clients to come and help me do all the mundane tasks of bundling up needles and cotton and alcohol swabs and give them pizza. And the idea of which is that we really want to get that population involved with our community. One of the problems with having a large staff turnover in my position is that when you lose that trust, you lose that connection. You stop hearing what the community needs. You stop hearing all of these different things. And so I'm hoping that by getting this engagement, I'll be able to get an advisory committee off the ground. And be able to do really fun things like invite in medical professionals and give our clients a safe space to ask questions about what to do if I have an abscess, what to do if this happens, what to do if this happens. And that notion has actually come out of some harms research that I'm not going to talk about at all because I know Lois is going to come up here and talk about it, but there's been a lot of research that has come out that says that these marginalized populations that we work with are very uncomfortable going to healthcare services. They're poorly received, their addiction is understood, their lifestyle isn't understood. And so we have developed a workshop that we are now delivering to frontline workers as a means of engaging them in a dialogue about this issue so that we can try to address this issue that's happening with clients not seeking healthcare and then their health obviously worsening. And so we've been invited into a human services class in Miramichi that we've already delivered. I've been invited into the ER at the Dr. Everett Chalmers Hospital in Fredericton, and I've been invited into addiction services to give this presentation, a very keen bunch of people that we work with. And we're really, really excited about all these projects that we have going on. And I guess that's all that I have. It's really just an update about the state of the province. Turnover, lots of numbers, lots of projects going on. Thank you.